The pandemic is now 1 year old. The Wuhan virus is mutating, it is changing shape, picking pace and infecting more people. Virus mutations are common. The Wuhan virus has mutated some 4,000 times. But we heard about it only last month because one particular mutation was dangerous. It's called the UK strain. It spreads faster. It has reached at least 13 countries already, including India. The latest cases of the mutated UK strain are in India. The mutation has been found in 6 patients, all of them recently returned from the United Kingdom. This is another reminder for those of you watching us in India. You're doing well, the vaccine's around the corner, but the threat is not past. This is not the time to let your guard down. The UK mutation is 70% more infectious. It is more dangerous. How worried should you be? What should and shouldn't you be doing? Tonight we'll discuss all of that. Let's start with the very latest. 6 cases, as I said, of the UK strain have been found in India. Even after India banned flights from the UK, these 6 people had already landed in India before the flight ban. And they're all Indian citizens. 3 of them are in Bengaluru now, 2 in Hyderabad and 1 in Pune. All of them are in single room isolation. Those who came in contact with them have been quarantined. What does all of this mean for you? Is the UK strain more dangerous? What is India doing to prevent its spread? Will vaccines still be effective? What should you do to keep yourself safe? We'll take these questions one by one. First up, how dangerous is this mutation? The UK strain. It is not deadlier, we can tell you, but it spreads faster. Let me explain. So you had the Wuhan virus, the one that caused the pandemic originally. Then it changed. This virus underwent 17 changes and it turned into what we call the UK strain. Now these 17 changes make it more infectious. So it spreads faster from one person to another. It also spreads faster from one cell to another. So the mutated virus will spread more quickly in the human body. It will take over a cell, it will replicate, enter another cell and repeat at a fast pace. And this can potentially overwhelm your immune response. In other words, it makes it harder for your body to fight back quickly, which means more serious cases, perhaps even more deaths. Plus, children and young people may be more vulnerable to this infection. So what is your defense? What is India doing to prevent its spread? Stepping up surveillance and contact tracing. That's what India is doing. Like I told you, the patients and their contacts are in quarantine. Their co-passengers, their families and their contacts are all being traced and monitored. And it's not going to be easy because reports say 33,000 passengers arrived from the UK between the 25th of November and the 23rd of December in about a month. 33,000 people. The state governments across the country are now reaching out to these passengers. They are being given swab tests. Their contacts are also being tested. Today, the Health Ministry of India held a press conference and this is what they said.
Prior to the news of the UK variant came in our country, we had done roughly 5,000 such genome sequences across these labs. Now we will be significantly increasing that number and would be working in a coordinated manner in the shape of a consortium.
And the timing couldn't have been worse because India was finally looking at some good news on the pandemic front. Fewer cases, fewer deaths. The pandemic was finally being controlled. Look at today's numbers, for instance. New infections today fell to their lowest in more than 6 months. New cases dropped below 20,000 for the second time in 7 days. But India is not letting its guard down. The government has issued new guidelines. States and union territories have been asked to keep strict vigil. And a lot of hope is riding on vaccines. Will they work against the mutated virus? The good news is they will. That's what most vaccine makers claim. The Pfizer vaccine, for instance, is being given in the US, the UK and Europe. And this company says the vaccine will remain effective. And if needed, they can modify the vaccine within 6 weeks. Same with the Oxford vaccine. Its maker AstraZeneca says the vaccine should be effective against mutations. The Oxford vaccine is yet to be approved by regulators for emergency use. It is the front runner in India. Which brings me to the next And the very obvious question, when will India get its vaccine? Going by most reports, very soon. Indian drug regulators are reviewing the trial data of the Oxford vaccine. The rollout is expected in January, a matter of days, not even weeks now. India has already conducted dry runs in 4 states. The Serum Institute has the license to supply the Oxford shot in India. Now, reports say this company has already made 40 to 50 million doses of the Oxford vaccine. Also reviewing the Oxford shot is the United Kingdom. Reports say London could give the green light by Thursday. India should follow soon after. But it will be a while before everyone gets a shot. So you have to wait your turn. In the meantime, what should you do? How do you protect yourself? Thankfully, those rules have not changed. You have to do what you've been doing all year. Wear your mask, wash your hands, avoid crowded spaces and maintain social distancing. The best strategies are often the simplest. So let me wrap this with some solid expert advice. Legendary molecular biologist Joshua Lederberg described humanity's struggle against new diseases in these words. I'm quoting him. It's our wits versus their genes. So keep your wits about you and keep your mask on. You should be fine. WION is now available in your country. Download the app now and get all the news on the move.